Dr. Samir Sinha was in Sudbury recently to speak at a Health Sciences North Forum on the future of healthcare for seniors. The Toronto geriatrician is the lead for the province's senior strategy and is determined to improve services for seniors. He sat down for a chat with Northern Life during his visit to the Nickel City. This is Headliners with Dr. Samir Sinha. Why does the healthcare system for seniors and in general need to be reformed?
Well, I think the key is we have to remember that when life expectancy back in 1900 in Ontario was only 51 years of age, and about 50 or 60 years ago when we actually created Medicare in Ontario, so our publicly funded healthcare system, the average age of an Ontarian, average age of a Canadian was only 27 years of age. And our life expectancy at the time was only 67 years of age.
Right.
So the fact of the matter is we created an entire healthcare system for people like you and I. Right.
So a person would retire and then they die, basically.
Well, people wouldn't live, long into their retirement.
Yeah.
Some people obviously lived longer than 67 at the time, but most people, we just didn't have people living, into older age that much. So things like home and community care, things like long-term care, we never even thought about those services, and those
Right.
weren't put in as part of the Canada Health Act. But now we realize that the average age of a Canadian today is 20 years older than it was 50 years ago. And we have more and more people living well beyond 65 years of age.
What's the average life expectancy now?
Yeah, great question. So the average life expectancy now for an older man is 79 years of age. An older woman, it's 81 years of age. We know that, unfortunately, for our First Nations and Aboriginal peoples in Ontario, that actually life expectancy is about 7 to 8 years less than the average Ontarian. So it really does speak to some of the disparities. But the point is that I always like to say we created a system for a much different population. I always like to say the patients have changed, but the system hasn't. So really this is an opportunity because frankly, if you have a system that's not matched to the patients who are using the system, clearly that system might not be delivering great care. And if it's not delivering great care, we might be wasting money and resources, and we might not be doing the best we can for our patients. So we really have an opportunity right now, in my view, to really recalibrate our system, re-engineer it, if it will, to have a focus around the people who are its greatest users, which are our older Ontarians. And by doing that, we can actually save money. We can actually make sure that our healthcare system will be a publicly funded system that will be sustainable for years to come.
What do these changes mean for seniors today?
So a $10 million investment was made to educate 47,000 frontline workers in our long-term care homes across the province to make sure they had more of the knowledge and skills they need to meet the needs of an aging population there. Our physiotherapy funding reforms have meant that we've actually increased our spending on home and community care physio in people's homes by $33 million, meaning we should be able to eliminate all of our CCAC physiotherapy waiting lists this year. But the thing I'm most proud about is the government hearing loud and clear that if older Ontarians want to age in place and stay at home, we need to have even more investments in home and community care. So if you'll remember some of the wrangling around the budget that occurred recently, the provincial budget, the NDP, said, I think in response to my report, Dr. Sinha is saying that, we need to invest more in home and community care. Franz Jelinas is our local,
Right.
Is our NDP health critic. And so one of the NDP's demands for the government this year was we want to see the home and community care, we want to see an extra $30 million invested into home and community care this year. Well, what I was pleased to see was the government, said, we not only agree with you, but, Dr. Sinha said this was such an important thing to do that we're actually going to invest $260 million, or a $250 million increase. So it's really neat to see that there's actually been a real nice alignment between our politicians and in fact, a real recognition that this is not only the right thing to do, but it's actually the most cost-effective thing to do to bring care closer to home.
So I guess an improvement for the seniors of today, you think?
Huge improvement because more and more people, I'll tell you what we've actually seen alone in our data is we have less people, because with more and more Ontarians saying that they want to live at home for as long as possible, these investments in home and community care are having a tremendous effect. In fact, we've actually seen the number of people actually being placed in long-term care amongst those populations who are 75 and older has actually decreased by 27% over the last 3 years. So it means that people can actually stay in their own homes now because we actually have a lot more home and community care available today than we did even a year ago.
Do you find that the home care system is adequate, though?
Do I think home care is
Yeah.
adequately funded in
Right.
Ontario? Absolutely not. I think we actually need to have even more investments, but I think, again, I know the Minister of Health has made it very explicit that every dollar she can save and every dollar she can find, she's putting it in home and community care.
Okay.
So again, political decisions that meant in order to make a 6.2% increase in our home and community care budget this past year, the largest ever in Ontario history, it meant that our local hospitals had to get a 0% increase this year. It meant that doctors had to agree, doctors like me, agree to a 0.5% pay cut in order to pay for that $250 million investment in home care. So do we need to invest more money? Absolutely. The government actually this past year committed to a $700 million increase in the home and community care budget over the next few years. But we will need to be making further investments over time. And I'm glad to see the Ontario government's taking that seriously.
What is healthcare going to look like for these baby boomers when they get to be in their 80s or 90s?
Oh, I think our baby boomers are quite articulate people who've actually seen the challenges of a mismatched system that as they've been taking mom and dad to the hospital or navigating our current healthcare system, they realize how inadequate it can sometimes be to meeting the needs of an aging person. So what I've really been impressed to see is that a lot of the baby boomers, some of them who I'm treating now as patients, but others who are caring for older relatives are saying, we really need to fundamentally change our system because it wasn't designed for the people who are using it now. So what I actually think we are going to see over time is further increases in home and community care, really interesting models of care that take care closer to home. A lot more, an increasing use of technology, for example, that can allow people to stay at home safely, but with the clinical expertise and support available through things like telemedicine and telehome care. So actually the Northeast LHIN is actually one of the 3 LHINs that's actually leading the province's telehome care initiative. So really thinking about what are the unique models that we can actually explore in community.
What's telehome care?
So telehome care is a system. This is actually being deployed by the CCAC here, and really what it is about working with patients in particular with chronic health conditions such as congestive heart failure or diabetes, and these are conditions where it's really important if patients really understand how to manage their conditions well and how to monitor their conditions well. So the telehome care technology means through the Ontario Telemedicine Network, these patients can have access to a special equipment that can help them monitor their own health, and they can actually, and then if there's any changes in the parameters, so if there's any changes where their blood pressure is too high or too low, they can get some coaching from a telehome care nurse who's getting that information as well, who can coach them and help teach them about their conditions and how to keep things stable, and most importantly, keep them out of hospital where nobody wants them to end up.
What will seniors care be like for those of our generation, our 30s and 40s?
Well, I hope, and the reason why I decided to take on the strategy is I think, change in healthcare takes time, but I think it needs to be as quick as possible to make sure that we have the right system. So, I think that by the time we get by the time we hit our later years, for example, I think all of us aspire to end up in our own homes if possible.
Right.
So we're going to really want to make sure that there's a great system that's really focused around providing care in the home or as close to home as much as possible, and we're going to have a workforce that is all learning how to take care of the elderly, because right now there's no health or social care professional in Ontario required to learn anything about caring for the elderly. So we're going to have a well-educated workforce. We're going to have a robust system, an integrated system where everyone's communicating with each other well. We're going to have no shortage of health and social care professionals in the north, and we're going to have great services that can allow us to stay at home.
So you're taking an optimistic point of view.
Well, I think, frankly, we've got 2 choices, right? We can either be a part, we can either kind of say, we're happy with having a system that won't adequately meet our needs, or we can say we're going to vote for politicians, we're going to vote for governments, and we're going to vote for change and support change that's actually going to get a healthcare system that works for us as we want to move forward.
Do you think we started too late, though, in terms of making the change for our parents' generation to make things better? is they're going to hit the system pretty soon, or they probably already have.
They already are hitting the system. I think I think there have been a lot of people before me who've been raising the alarm bells and saying, wait a minute, ever since the baby boomer phenomenon started, we've known that this demographic change was gonna come later on. But there were a lot of things I think we could have easily done 10 years ago, 20 years ago. But you know what? Sometimes you have to be faced with the problem right head on before you realize, wow, I guess we couldn't put our heads in the sand any longer. So I think we're really at an opportunity right now where we have to say, okay, well, maybe we missed an earlier opportunity, but there's no time like the present to get things right.
So I just wanted to talk a little bit about Sudbury, and there's been some efforts by our local hospital and our other local organizations to try and keep seniors out of hospital, not only because it's costly to the system, but because, as I've learned, hospitalization is very harmful to seniors. So what do you think of the hospital's efforts in this area?
To be honest, I'm not too familiar with the hospital's efforts, locally, for example. But I understand that Health Sciences North is interested in making their hospitals more elder-friendly, and I think it's a real important thing that I would love to see them really, accomplish that goal, envision that goal. These things take leadership. And it really requires organizations to be honest with themselves, right? So it's one thing, as I've seen across Ontario, for hospitals to say, we are senior friendly.
Right.
It's another thing to actually demonstrate that you are as well.
So what kind of advice would you have for local healthcare organizations to further enhance their seniors' care?
Yeah, I think it's about, again, making choices and priorities, right? There are very few hospitals in Ontario that have actually made seniors' care a priority for themselves, right? So, Mount Sinai in Toronto was the first acute care hospital in Ontario to actually make this a core priority. I think every hospital in the north, given the fact that 60% of our inpatient bed days throughout the province are accounted for by older people, I think that every hospital in the north should say that geriatrics is their priority. And when you make it a priority, then you make sure that you reorganize things. You make sure that this care of this vulnerable population is a priority. So I really, really am hoping that we're going to really see a sea change in our hospitals throughout the province to say, yeah, this makes sense. Because frankly, we've been able to demonstrate that at our hospital in Toronto by doing things a little bit differently that are in line with providing better patient care for our older Ontarians. We're able to deliver some terrific results. So I'm really hoping to be able to support the hospitals in the north as well by sharing our information to show what we've been able to do so that they can deliver outstanding care to their older adults every day.
For Northern Life, this is Heidi Elrickson.